So you try to feel for where the biceps muscle is, and just work your way down it. This can be kind of tender or sensitive on some people, so just be aware of that. Okay, working down. Okay, and then kind of going a little faster on it. Okay, when you get to the elbow, pericardium 3 at the elbow is just to the pinky side of the biceps tendon. Okay, still pretty much in the center of the elbow joint. And then you continue working your way down the lower arm, staying right in the middle. As you get closer to the wrist, you know how you have these two tendons that stick out on the front of the wrist. I'm trying to make it stick out a little bit, but the two tendons on this pale portion of the wrist. The pericardium channel basically runs right between those. So as you get closer to the wrist, you try to aim so that you're going between those two tendons. Okay. So pericardium 7 is right at the wrist. Pericardium 8 is called Laogong, and it's right in the middle of the palm. Like if you take your middle finger and you stick it down this way, right into like Spider-Man or something, like you're kind of hitting the where pericardium 8 is. Okay? And then the pericardium channel ends with the middle finger, so I just kind of slide off the middle finger here. And then you can do the same things, again, a lot of like grasping and more focused work if you find anything, okay? So I'm just going to be going relatively quickly with it. Okay, and then again, you can also do like the pushing. Actually, when I'm doing it this way, it's more like I'm pulling towards myself, but it's the same idea. Like I'm applying pressure and then moving in a direction, like along the channel. Okay, for the heart channel, heart channel, if the patient can do this, then you take the patient's arm this way, and the heart channel is exposed here. Okay? For some patients who are really flexible, you can take the arm higher this way, but there are a lot of patients who have like shoulder restrictions, and if you can take the arm this way, but you can't bring it down this way. Their arm is like, their shoulder won't let you turn the humerus out this way. And then, in those cases, you have to go, you have to stay lower this way just for the comfort of the patient. Okay, but ideally, you can bring the arm in this position so that you expose more of the heart channel. Okay, heart channel technically, it begins right in the center of the armpit. You can work in this this spot here. Okay. Part 1, I mean, when you're dealing with shoulder problems, it is actually a good point or region to work, because it's the only point that gives you access to the front of the shoulder blade. Deep in that area, and then. A lot of times when you have frozen shoulder, you have involvement of some of those muscles deep in the shoulder. Okay. But for our purposes, we're just going to continue working down the heart channel. One thing you have to be very careful about with regards to the heart channel is, especially as you get closer to the elbow and you're pressing on the heart channel here, you know, again, heart channel is more on the pinky side. The ulnar nerve, it gets pretty, it travels kind of shallow, especially towards the elbow. So you don't want to be putting a lot of heavy pressure in this area, because you can kind of aggravate the nerve. Okay, so usually actually for the heart channel, I like to use, instead of like my thumb, which is more penetrative, I use like the pads of my fingers. And as you get past the elbow, yeah, so heart 3 is supposed to be, technically it's supposed to be between the pericardium channel and this medial epicondyle of the humerus right here. There's a bone right here. Okay, so it's right in between. So this is where heart 3 is supposed to be. But just so long as you have the general idea of being more towards the pinky, I can help people locate that. And we just work our way. Again, I'm going a little bit faster now. Okay, heart 8 is also on the palm, but heart 8 you can find it basically by if you get your pinky finger and you curl it into your palm, where the pinky touches the palm is basically where heart 8 is. Yeah. And then heart 9, just let your finger slide over the pinky. And we can do a lot of the same things, like the grasping and also the pushing. This way. Sorry, let's go. Okay. Let's see. Then I'm gonna move over to